Hello, everyone, and thank you for joining us today. I do see that we still have some participants joining right now. So hopefully everyone is ready to begin today's LC session. So in today's session, we will be covering our fourth session on interventions in engaging community health workers. And this is part of our learning collaborative on addressing barriers to colorectal cancer screening. This is also brought to you by the National Center for Health in Public Housing. This is just a kind reminder to you all that all participants are muted upon entry. Please make sure that you engage in the chat if you have any questions or any comments or any promising practices that you would like to share with us today. Please raise your hand if you would like your line to also be unmuted. This meeting is also being recorded, and the slides and the recording link will be sent to you all via email after today's session. This is just some information about NCHPH. The mission of the National Center for Health in Public Housing is to strengthen the capacity of PHPC grantees or public housing primary care grantees and other health center grantees by providing a range of training and technical assistance. NCHPH is also a project supported by the Health Resources and Services Administration and is a national training technical assistance partner that is 100% financed by this grant. And the information presented today are those of the author only. And this is just a brief introduction about the speakers for today's session. My name is Filipina Sandoval, and I am the TTA manager here at NCHPH. With us, we also have Dr. Jose Leon, who is the Chief Medical Officer at NCHPH. And we also have the honor of having with us two guest speakers from Camilla's Health Concern. We have Ana Velez. She is the Clinical Outcomes Manager at Camilla's Health Concern. And we also have Noemi Romo, who is the Director of Health Education Services at La Maestra Community Health Centers. Okay, and then without further ado, I will pass it on to Dr. Jose Leon so that we can begin with an icebreaker and some other information related to today's topic.
Thank you, Fide. Hello, everyone. Good morning or good afternoon. It's such a great honor to have you all attending the fourth and last session of our learning collaborative on colorectal cancer screening. It's been a pleasure to trek through many different aspects of colorectal cancer screening and have conversations about the recommendations from the American Cancer Society or the United States Preventive Task Force. We have had the opportunity to talk about messaging and what resonates when we send messages to our patients and reminders on colorectal cancer screening. We have briefly talked about healthy habits as well. So thank you so much for being here. And I am very pleased and I'm very honored to have two health centers participating. So please make sure that if you have questions, you have two health centers, two colleagues who are in the communities providing exactly the same services that you are providing and facing the same challenges that you may have as well. So if you have any questions for them or any question for us, let us know. And if you have some time, can you please add your name, your organization, and where you are, the state that you are in, to start our conversation. And then we have an icebreaker, and we are asking today, what is the best concert or festival you have ever been to? So please, if you can just add those responses to the chat, that's gonna be great.
Okay, so we do have some responses that are coming through Dr. Leon. And right now we have Brad Paisley concert. We also have a Karen Gattinson. Oh, well, she's joining from us. Karen Gattinson, she's a CHW in Connecticut. And somebody has attended a Michael Jackson concert. Wow, that's exciting. And probably Paramore. Very nice. I'm a fan of Paramore. And then with us, we also have Eva. She's a community health worker from Terros Health in Arizona. And the best concert that she has been to is the Ricky Montgomery concert. Awesome. We've been getting a lot of really good responses.
Excellent, and thank you so much for that information. I think that the best concert I've attended, there was a concert and I went to see the Rolling Stones as well. Here we are in the Washington, D.C. area, and it was one of the best concerts I ever seen in my life. So thank you so much for participating. Next slide, please.
Awesome.
This is just a quick reminder about the expectations that this is a learning collaborative. The idea is to have interaction with all of you and a space to share the experiences that you have in the community when you are working with other members of your health center to improve or increase colorectal cancer screening rates. And so please make sure that you participate, that it's okay to make mistakes, that we are all learning, and that, again, that this is a learning collaborative. The idea is just to have this interaction and making sure that we address our needs and learn from what others are doing. Next slide, please. Today, we are going to go over to the CPSTF recommendations regarding the role of CHWs in colorectal cancer screening. We are going to identify colorectal cancer screening interventions in the community and clinical sites. And we are going to briefly discuss interventions that engage CHWs in colorectal cancer screening. Next slide, please. So we will try to discuss also a case study. So this is going to be what we are going to be doing if we have time. Right now, the priority is to hear from the two guest speakers about what they are doing in regards to colorectal cancer screening. But if we have enough time, we are going to go over this case study. Next slide.
I'm telling Jackie, yeah, already had it over the pantry too. You got cold food.
Excuse me, sorry, Dr. Now. Before we continue, I would just like to kindly ask participants to please mute your line so we don't have any interruptions throughout the presentations. Thank you.
Thank you, Fide. So let's get started with our topic for today's session, and is the recommendations from one of the organizations, the Community Preventive Services Task Force, recommending the use of community health workers when we are doing or when we are engaging with the community and trying to make sure that the patients who are at risk or they are at the level, you know, the recommendations to get screened. So this Community Preventive Services Task Force has provided these recommendations based on data and research and literature review. These are not recommendations that are made by this organization just to mention the use of CSWs, but they have evidence-based data that supports the use of CHWs to improve or increase colorectal cancer screening in the communities. Next slide, please. The major findings are that all interventions that engage community health workers are necessary when we are reaching out to communities, especially when we have a population that is diverse. So we've been talking to our, before we started this conversation, we were talking to our two panelists, and they are going to provide additional information about the diversity of their populations and the need to have interventions and outreach interventions to address the needs of the populations that they serve, but at the same time to help in the colorectal cancer screening recommendations. There are several studies, as I mentioned, 17 studies addressing the intervention that engage community health workers, that 22 studies that also recommend the use of CSWs when you are doing breast, cervical cancer screening and colorectal cancer screening. And again, these interventions are necessary in the communities to help our patients and get screened for not only for colorectal cancer, because the recommendation is also to use CSWs or to incorporate CSWs on other activities such as breast and cervical cancer screening. Next slide, please. There are different functions, and we are going to go over these later on, but CSWs can help not only going out in the communities and talk to patients about the need to get screened, but they also provide culturally appropriate health education. There has been a conversation. The Center for Disease Control and Prevention, for instance, has a really good document on the policies, on the instructions on how to provide training to CSWs, what type of training can be provided, and what restrictions are. There are some restrictions as well, depending on the state that you are living in or the community that you're serving. So I always invite participants to go and visit the CSW page on the Centers for Disease Control and Prevention website and read that document, because it's extremely useful if you are planning, if you are already working with CSWs in the community, providing some health education to them, that's excellent. But if you are trying to start or a new program and you are trying to incorporate CSWs, it's always important to read that document. Next slide, please. So there are two ways, right, that we can help, or CSW can help. One is in the community and to increase community access. We've been talking about either provide one-on-one education, group education, send client reminders, work with the team, and specifically if you have a community with Hispanic or Latinos or from other part of the world, and you are trying to convey a message that resonates amongst the populations that you serve, that is a great use of CSWs. Also to create and provide small media. Then there are other interventions to reduce structural barriers, reduce administrative barriers, and they can help with appointments and schedule appointments, or help the patient, or go to the community and help patients with transportation issues and everything that they do in the communities, as well as the language translation. And there are some documents even mentioning, and this is coming from the same organization, that they can help with interventions on providing childcare. Next slide, please. The idea is to train our CSW with the basic information, or the information that they are going to need to educate our patients, either in person or in groups. There are several ways or several topics that need to be included. You have a list of all the potential education topics that you can incorporate if you are planning to to work with CHWs or patient navigators and making sure that they understand the issue, the reason why our patient needs to get screened, what is the age-appropriate recommendations, and specifically the idea of being with the patient, of understanding the patient since they are part of the community. Next slide, please. There are other studies providing information about who needs to supervise CHWs, how you can integrate them in the medical team, the compensation that they need to receive, and whether or not they're part-time, full-time. So that these you are going to receive these slides with all these resources. And so you can go over these recommendations and see the studies as well. And you can modify them or you can adapt them to the needs that you have in your community. Next slide, please. So this is our case study. I'm going to stop for a moment because the idea for today's session is to hear from 2 health centers, from 2 of your colleagues who are providing the services to patients in the communities and addressing colorectal cancer screening. In their communities, we have the opportunity to hear from 2 health centers located in 2 different geographic areas of the United States. So I'm going to turn it over to Anna. Hello, Anna.
Good afternoon, everyone. Thank you very much, Dr. Leon, for inviting us. I hope everybody can hear me.
We can hear you well.
Okay, thank you. So today we will be presenting on colorectal cancer screening, challenges and opportunities for community colorectal cancer screening. Okay, thank you so much. Fine. So again, I am representing Camilla's Health Concern. I've been with Camilla's Health Concern over 6 years. I am a registered nurse, and I am also the clinical outcomes manager. Next slide, please. Just to give everyone a little bit of Camilla's Health Concern background. So we are located in Miami, Florida, and we do have 3 satellite sites. Only 2 are listed here, but on this next slide, we do have the 3. So we do have a clinic at our sister organization, which is the Shelter NCL Campus, Camilla's House, and then also Salvation Army. And we also have a site, which is the Street Medicine Program. The history of Camilla's Health Concern. So we were founded in 1985 by the Brothers of Good Shepherd, which is now the Brothers of St. John of God. We are one of 1,400 FQACs nationwide and nearly 50 in Florida. We are the only FQAC whose mission is to provide healthcare services to those experiencing total homelessness in Miami-Dade, in the Miami-Dade area. Next slide. Who we serve. So as per 2023 UDS, we did serve 6,050 patients, and we had a total of 35,620 visits. And as I mentioned before, we have 4 operating sites, which is our Greer building, which is our main building. It is located very strategic in the downtown area in Miami-Dade, which is a perfect location for our population. Our NCL clinic located in Camilla's House. And we also have a clinic, which is the Health Resource Center at Salvation Army, and our Street Medicine Program, which is Outreach. Just wanted to pause here and just give you also a little bit of the background of our patient diversity. So mostly of our patients are Hispanic. So I can say around 60 to 70% of our patients are Hispanic. And then our next bigger group is the Black African American group. And also just to give you a little bit of our numbers, around 80% of our patients are both homelessness and our patients that experience homelessness and also uninsured. Out of the 80%, 55% are patients experiencing homelessness and 25% are uninsured or underinsured. If we can go back, feed, please. The services that we provide at Camillus Health Concern are adult primary care, pediatric care, women's health preventative, outreach, podiatry, dental, behavioral health, and case management. Thank you. Next. Screening strategies. So what do we do in order to increase compliance and within this measure? So we do send patient reminders via text, via our EMR, through my chart, and also we send letters and we call our patients. We have established a program which is patient incentives. So every time a patient brings the sample back to us, we do provide them with a Publix gift card. And that Publix gift card, it's around $10. And we were very lucky to find funding for that patient incentives through a grant. We also have established a colorectal cancer screening champion program. So usually it's within the MAs, and we ask around who's interested in participating this quarter and to be the champion in the program. And we are having conversations with our leadership group to see team to see if we can also incentivize those MAs to increase our rates. Colonoscopies, we continue to have challenges with our community hospital, which is Jackson. It is extremely challenging to have our patients look for appointments. We do have a referral system, and it continues to be very challenging, also due to our patient population do not have the means to pay for a co-payment or the full colonoscopy. And by the time that the patients are able to fill out free service in order to complete the colonoscopy, it could be late or there's some gaps in care. So for our less than 20% of insured patients, we have determined that there's two ways that we can close those gaps, and that's through Quest, which is the Quest Fit Kit Mail-Out Pilot Program. So we run the list of non-compliant patients and we share that with Quest, and Quest will send the kits by mail with instructions and postage paid, and the patients do return the envelopes. The final results are shared to us. The other way to close the gaps is with the Insure One kits. So that kit, that's the one that we are looking to partner with because it is very easy and alterations in the final process are very few, and the patients just take a sample and this tool while is in the toilet. So that's a very interesting way, and I will recommend everyone to do a little research more deeply on that one and see if your managed care company does cover that. Next slide, please. So just to be a little bit fun here and bring some attention, just a few facts, true or false. So colorectal cancer screening is the second leading cancer killer. That is true. Both men and women get colorectal cancer. Absolutely. Colorectal cancer screening often starts with no symptoms, and that is true as well. Screening helps prevent colorectal cancer screening. That is the main idea, absolutely. Next, challenges. Again, our challenges, our biggest challenges is the underinsured or uninsured population, which again, I share with all of you that that's our biggest chunk of our patients. Barriers to care entry, it is very difficult for our patients to be thinking, oh, my FOBT or FIT, it's due, and they don't have a plate in their table. So we do deal with social determinants of health every time that we are closing gaps. We try our best, and I'll give you the numbers where we are and where we closed 2023 when it comes to colorectal cancer screening performance. Difficulty performance screenings, again, due to the extreme heat here around the Miami area, there's many issues when we give out the patient sample, the container for the patient to bring the sample back. Usually they have to look for a public bathroom and they will bring back the sample, and it's a LabCorp, or we also process those fits in-house. They come back, they were not processed due to, again, the weather. Test preparation, again, patients have to look for public bathrooms, so it's a challenge. It's not that, you know, for those patients that do have ways and means to complete it, it comes much easier. Social stigma, we all know it's not an easy screening because people do feel uncomfortable bringing the sample back. Long wait times, as I shared with all of you, are challenges for colonoscopies, and when we have a positive fit, how do we close the loop? That's very challenging, and we do help our patients to look for appointments, and we do everything that it takes to close the loop on those patients. And loss to follow up, again, many of our patients do not even have cell phones. So it is difficult to find and share with all of them their result. Thank you. Next slide. What can we do? These are things that we are, of course, working on and continue to work on. So identify resources. We need to be able to identify more grants in order to increase our patient incentive or continue with the program. We need to provide additional education to reduce stigma. And of course, just continue our campaign for early and regular screenings and do more fit days. We've done them in the past. We did had a pause during COVID, but now we are fully on board. Best practices. So this is what we do. So we have a street medicine program, and we added our CAP members, which is the Consumer Advisory Boards, to help us to speak to the community. That will be like a peer-to-peer outreach. Those Consumer Advisory Board members are patient of ours as well. And they have either experiences homelessness, so they understand what the other patients around the community are going through. So that has really, really helped us closing those gaps. Through community engagement, they really help us, you know, speak to everybody in the community, educate on the importance of those screenings. We also need to increase our education through mixed media and posters. We do have posters around the clinic, and we have TVs where we go ahead and share educational information while the patient is waiting to be seen. And closing the loop, reminders, as I shared with everyone, testing and follow-up, and continue with our patient incentives. Next slide. So this I share with everyone who is the Camila's Health Concerns team. So as I said, the Consumer Advisory Board and medical students and pre-health professional students are also part of our street medicine program. They assist our staff in performing colorectal cancer screening and running those tests as well. Next slide. Camila's health concern process. We identify patients in need of screening, and we track them annually and throughout the year to make sure, you know, we don't fall behind, of course. So that takes planning. Engagement activities, as I share with everyone, we utilize the CAP members, and also we do health fairs, and we do a deeper dive when it comes to patient education and incentives, giveaways. We've done goodie bags also in the past, and that really helped during our fit days. Our street medicine program, our medical students are also super active, and they help us with the education and just do the process of the screening, and run, you know, the whole screening process throughout the day. Next slide. So this is our final result. As you can see on your left side, this is what we do while we are either in one of our sites or also during outreach. We provide the stool test. We give them a Publix gift card, and at the end, happy to share with everyone, we did get the HRSA Health Center Quality Leader for 2023, a gold. And now, any questions?
Thank you, Anna, for your presentation and for everything you do in your community to help people experiencing homelessness, one of the special populations listed by HRSA, and a very hard to reach population. So thank you so much again for participating and for doing what you do in your community. Any questions for Anna? Please make sure that either we use the chat, or if you want the line to be unmuted, we can also unmute your line. But this is a really good opportunity for all of us to ask questions and making sure that if there is anything that you would like to address or that you would like to modify, this is the opportunity. And I see a hand. Fide, can you please unmute her line?
Yes, of course. And we also have another question in the chat.
Okay.
But we can go over that, you know, just accordingly. But yeah, let me unmute the line for Marianne.
Hi, yes. My name is Darlene Burton. I'm a part of Esperanza's Health Center. I do have a question. So, you said that if they struggle with finding a restroom for the fit test. I would like to know if they have a positive fit test and they need a colonoscopy, if they can't afford or are underinsured to get the colonoscopy, if the colonoscopy comes back positive for colorectal cancer, how then will they afford the cancer treatment that may be necessary for a positive colorectal screening?
I'll be happy to answer that for you. So again, that's one of our biggest challenges. So our community hospital, Jackson Memorial, they have programs, which is the J11 usually, and that is for very low income population where they will cover all the wellness, like colonoscopies, mammograms, and also intervene in case they need chemotherapy, if that's the case, right? Or any other surgery. Now, the process within the community hospital is very, very long, and it does take time, unfortunately. That's for the J11. Now, there's more programs within the hospital, our safety net hospital, but those programs are similar. It takes time. They need to do interviews. They need to prove they have low incomes. So it's a process. So again, I think it's something that it's out of our control, but we continue to see the patient and we advocate for the patient in order to have whatever they need to have. But that's basically all that we can do. I wish it would be different, but that's where we start really wondering what else can we do.
Thank you, Anna, for the response. And Fide, you said that we have another question in the chat.
Yes, that is correct. So the question is, can you speak more about the fit days, or did I already, well, just can you speak more about the fit days?
Yes, sure. So I believe it was in 2018, 2019, we said, let's give it a try and see what percentage we increased overall in performance doing our fit days. And we did try it and it went well, but not as we really wanted it, or we were expecting to. Even though we had raffles, we had a lot of activities, but it didn't really work as expected. So we changed and said, okay, instead of doing fit days, why don't we try and include our CAP members doing our street medicine program, include our medical students so they can provide more education and just give those incentives within the clinic. You bring me the sample, I give you the incentive.
Excellent. Thank you so much, Anna. And I have a question for you, and is in regards to collaborating with CHWs. What is Camillus Health doing, in this aspect? In other words, what is the role of the CHWs when it comes to go to the community and increase either colorectal cancer screening or any of the quality measures that you are reporting to HRSA?
Well, they are essential within the community and for us as part of the workflow, because they are the ones who help us educate the patients, educate the community, and also help us try to close the loop with every single measure. That includes A1Cs, that includes breast cancer screening, cervical cancer screening, depression screening, every single measure that we focus on. We give them a little of education before they go out and help us distribute this information within the community. And we've seen how important, and I will believe that has to be like a must to include all the community healthcare workers within every single clinic.
Thank you. And my last question is in regards to the population that you serve. Many or most of your patients are people experiencing homelessness. And one of your slides was about sending reminders. So what is the strategy when you try to reach out to those who have no place to live, and somehow you need to follow up with them, to make sure that they receive the services?
Sure, Dr. Leon. So we 4 years ago, we did receive a funding for cell phones. And we did a pilot program and we were giving out cell phones to our patients based on different chronic diseases or comorbidities. At the end of the day, it worked and it didn't work. Many cell phones were lost, many things happened, but we were able, some of the patients were able to keep those cell phones. We were paying for the service, we paid for the cell phones. It was the whole thing. So through that grant, we also closed many gaps, and those patients that do have a phone, we send them the reminders, And believe it or not, there's within that homelessness population, again, believe it or not, I won't say no must, but a big percentage of patients do have a cell phone. And I will say 20% of those homeless do have a cell phone. And it's like, and you think about how do they charge them and how do they continue keep service? Well, they do. And I believe that will be like their most important gift they keep and they take care of.
Thank you so much, Anna, for answering the questions, and thank you so much again for your service in the Miami-Dade community. So thank you, and now is the opportunity for Noemi Romo from La Maestra in San Diego, California, to talk to us a little bit about what they are doing to address this important issue in our communities. Good afternoon, Noemi. Did we lose her, Fide?
Let me. It looks like she's still in the line.
I think that she's muted somehow.
Yeah.
So let's see. Noemi, are you back?
Good afternoon, everyone. Can you hear me now?
Yes, we
Yes.
can hear you.
My apologies. I'm on my phone and computer, so you'll see me in two places. Well, thank you for the introduction. Hello, everyone, and thank you for allowing me to be part of this discussion today. Again, my name is Noemi Romo. I'm the Director of Health Education Services at La Maestra Community Health Centers in San Diego. I've been with La Maestra for 16 years. And before I dive into the efforts done by La Maestra to bring awareness to the importance of colorectal cancer screenings, I'd like to give you all a bit of background information of La Maestra and who we are. So next slide, please. So La Maestra is a federally qualified health center serving the communities of San Diego since 1986. Initially, we started off as an amnesty center, and in 1990, the La Maestra Family Clinic was founded after identifying that the communities that we were serving were in need of linguistically and culturally appropriate medical care. We follow our La Maestra Circle of Care, which is diagrammed in that small flower at the top right of your screen. So in the center, we always place our patient. And the surrounding petals each represent a La Maestra department that's designed to address social determinants of health and meet a patient's specific needs. It's a holistic, solutions-based approach to addressing the health and well-being needs of our diverse emerging communities, because complete family wellness requires more than just a trip to the doctor. La Maestra works to provide and connect communities to nutritious foods, safe, affordable housing, job training, and other programs that promote well-being. With now 12 locations throughout San Diego and counting, in 2023, we identified that La Maestra serves patients that preferred 70 languages and dialects. It's 5 more than in 2022, so we have a very diverse patient population. And as we continue to identify our patients and their changes, we're expanding our services and locations to respond to their needs with the intention of empowering individuals in a linguistically and culturally respectful manner. The next slide. So as I'm sure you all can agree, that connecting and engaging community members takes a team of like-minded individuals working together and trusting one another. Here's a list of some of our essential La Maestra staff that do just that, to bring awareness and educate, support our communities. First, we have our medically trained cultural liaisons, or our MTCLs. It's our team of medically trained professionals that are stationed throughout our sites. They are active members in their culturally diverse communities, and they speak 18 languages that are the most preferred by our patient population. They act as interpreters, translators, community and staff liaisons, and they play an integral role in creating a trusting relationship with the communities we serve. Another essential team is our CHWs. Just like our MTCLs, they're active members in their culturally and linguistically diverse communities. And although they may not necessarily have a medical background, they are trained to go out and engage and empower individuals to take charge of their lives. We also are fortunate to have our health educators. They are trained to provide culturally and linguistically appropriate foundational health education and information. They're trained to communicate with medical providers, connect patients with our circle of care resources, motivate and maintain healthy lifestyles. And of course, needless to say, we also have an amazing medical team, from our medical assistants, lab and pharmacy techs, to our medical physicians who, like our circle of care, put the patient in the center and work together to support our patients in achieving their unique medical goals. This team and many more staff all come together to support and give a voice to our communities. Next slide, please. And so just like it's necessary to have a variety of team members to come together to support our community, La Maestra uses a variety of modalities and techniques to get our messages and services to individuals. So the left column, it lists the engagement efforts done throughout our communities, outside of our walls per se. So first is word of mouth and materials distribution. We know that our communities trust their neighbors and share a lot of information on their front porch. Our CHWs go to various common community congregation sites. They meet and talk to people and share information about La Maestra services, such as colorectal cancer screening. Social media platforms, that's another big one. After 2020, we identified that our patients, young and older, have become very tech savvy. And at times when someone is confined to their home and or has limited mobility, social media to many is the connection to the outside world and can be a great resource to, again, bring awareness to different topics. This is a platform used by all our essential staff, our MTCLs, our CHWs, health educators, and medical staff. Text and letter dissemination campaigns, similar to social media, La Maestra uses a texting platform to disseminate campaigns, such as bringing awareness to the importance of colorectal cancer screening. Through this platform, we're able to send campaigns to all of our patients or a select patient group. In short, we enter a patient's criteria in the platform. We select or create a script and for how long and often we want the campaign to run, and send the message out to our patients. Again, all play a part in creating an effective campaign for our patients. For health fairs, we bring awareness to our La Maestra services, and many of our departments assign staff to attend all health fairs, whether it be at a La Maestra site or at a community-sponsored event. Community partner engagement events, we also bring our health fairs and educational presentations to schools, libraries, churches, anywhere throughout the community that seeks our services. Will go out and provide information and awareness to those patient populations. We are also very fortunate in having a mobile clinic that allows La Maestra to bring the complete team to those hard to reach locations in our county and connect with those individuals. But again, of course, once we get the patient through the doors, great, we've got them to our site, but we continue to make sure that our patients get connected to our services, including colorectal cancer screenings. So on the right, we have our direct patient efforts. Once we have established an individual to be a patient, we offer that one-on-one health education. So all of our curriculums include the discussion of preventative screenings, including colorectal cancer screenings. We identify those individuals that are in need and use a warm handoff technique to connect them to a staff that can assist them. Our medical team, along with standing orders, work to provide the screening kits to all of the patients identified as being due for a screening. So in 2023, we were able to screen 65% of the patients that were identified as being due for a colorectal cancer screening. And again, we continue to find different strategies and efforts so that hopefully in the coming years, we can increase those figures. And again, once a patient is established, we continue our efforts to bring awareness. And in 2023, 2,000 letters were sent out to individuals regarding colorectal cancer screenings in the hopes of, again, increasing those figures to capture more individuals. Here's a few images of our mobile unit, our community health workers and educators doing their work, and the materials that we give our patients in a variety of languages. So if you have any questions, please feel free to ask any questions that you may have. Thank you again.
Thank you so much again for your presentation. If you have questions, please, like we did, either your line can be unmuted, or if you have questions that you would like to type your question, we can use the chat box. Just a reminder while we wait for some questions is that there is a post activity survey. We are kindly asking participants to please complete the survey. And if you would like to obtain a certificate of participation, we are also offering that. So you can contact me or you can contact FIDE, and you are going to get one of these certifications. And I think that there is a question from Eva. Do you have any advice to encourage colorectal screening kit completion to those patients that don't want to do them because they're grossed out by them?
So I think Anna touched on something that was really helpful. It's bringing awareness and continuously talking about it and discussing the importance of it, making it common kind of discussion, I think is the most important thing. Once you have it as common language and it's, we use our social media platforms, we talk about it in all aspects of whether it be at a health fair, where the public is around, or whether it be social media. The more you talk about it, the more you make it just a common discussion, the grossness kind of goes away, right? You start to understand that, yes, it's uncomfortable or it's kind of awkward at first, but it's so important that you start to kind of move past that. So I think the more you talk about it, the more you openly discuss it in different areas with different staff members, I think that's kind of the key to taking away that stigma.
Excellent. And there's another question from Evelyn. Do you only have one of each staff, CHW, MTCL, HE, and how large the population you serve is?
That's a great question. So we have we're very fortunate in creating teams of MTCLs. I believe currently we have 27 throughout our 12 sites, right? So we do serve a large patient population in San Diego County. So we have about, again, 27 MTCLs. We roughly have around probably 20 CHWs. We have 10 health educators. So we do have a large team that we've built over time. For many, many years, the health education department was just me. It started with one, but little by little, you start to see the importance of having these programs and these departments in place. And we have been very fortunate through grants to be able to fund a lot of these departments that we have.
Excellent. Thank you so much for that. And Fide, is there any other question in the queue?
No,
Oh, we have a hand.
yeah, we do.
So
Thank
from Marianne.
Hi, again, my name is Darlene Burton. I just would like to know, what advice would you give to a colorectal cancer navigator to help them to convince patients to be screened that may be fearful of the results?
That's a very good question. And that's, I think, again, it's the making it common language, right? Making it a normal conversation. And possibly for that individual that is fearful, maybe proactively preparing or having a list of resources for them if they do become positive. So closing that loop, right? So here, I really recommend that you get the screening done. And if something happens, we have resources to send you to. So this is not the end, right? It's not just, oh, you're positive and let's figure out what you're going to do. But maybe having those resources in place. Okay, look, if something happens, we're going to walk you through this. We're going to create a plan for you. So maybe showing, and maybe not focusing on that, right? Again, we want a patient hopefully to have good results, but if they do have a positive result or an adverse result that needs maybe more attention, we are going to still guide you and we're still going to support you and help you through that. So maybe just that reassurance that this is not the end, that could help to kind of maybe motivate that individual to actually take that test.
Thank you so much.
Thank you.
Yes, of course, thank you.
There is a comment from Adriana Rojas as well. And she's saying that she also thinks that one approach is to help people understand that it's worse if they put off the screening due to fear. If we can catch it early, it will be less disruptive to their life. But whenever it's caught, here are the resources. So thank you so much for that as well, Adriana. And just to chime in on that topic, during our third session that was last week, and you will have access to all these recording and slides. It's my understanding that our team will be sending all the materials and slides, and they also will be available on the website. We also had a conversation about sending positive messages when someone is fearful, saying that colorectal cancer screening is the test recommended, and if you catch the condition early, the condition is treatable. So in my opinion, that's a very positive message to give to someone who is so fearful to get screened. Letting them know that there are options for them if we detect or we catch the colorectal cancer screening in the I mean the colorectal cancer in early stages. And there is another comment here from one of the participants that education is the key. Correct. We need to keep working on educating our patients, and that's the role of our staff, not only the clinical staff, but the support staff, making sure that everybody has the basic knowledge to address any questions on any issues from our patients. So thank you so much. We are at the top of the hour. Again, thank you so much for your time, for attending these 4 sessions. In the next program year, starting July 1st, we will continue this topic. We will continue to discuss it. So you are going to receive updates on the new sessions that we are planning to do on colorectal cancer screening. So stay tuned. For those who participated, again, thank you so much. For Anna and the other participants, and please thank you so much for being with us. Thank you so much for attending this activity. And again, on behalf of the National Center for Health and Public Housing staff, thank you so much for participating. Thank you and have a great afternoon. Thank you, Noemi. Thank you, Anna.
Thank you very much. Have a great afternoon, everyone.
Thank you.